Glucosamine and chondroitin are very popular supplements, and they are advertised to help with joint pain and arthritis. But do they really work? This is my second video in a mini-series about supplements, where I will discuss the scientific evidence that we have about glucosamine, chondroitin, collagen, fish oil, turmeric, and vitamin D. In this video, I will discuss what are glucosamine and chondroitin, and are glucosamine and chondroitin really good for arthritis?
rheumatologist
Hi, I'm Dr. Girnita, the founder of Rheumatologist OnCall. In this YouTube channel, I educate people about arthritis, autoimmune diseases, and different ways that you can use to live better with arthritis. If you're new here, welcome. Don't forget to subscribe. But if you have been following this channel, I'm very excited to have you back and share more information with you. What are glucosamine and chondroitin? Glucosamine and chondroitin are normal components of the cartilage tissue. They will participate in building other components into our joints. In certain diseases like osteoarthritis, both chondroitin and glucosamine are decreased. Naturally, many believe that taking a supplement will be an efficient way to stop or slow down the progression of arthritis. As I mentioned in my previous lecture about collagen and the role in arthritis, supplements are natural and or synthetic products marketed to be added to your diet for optimal health results. However, because dietary supplements are categorized as food and not drugs, they are not required to undergo rigorous testing like prescription medication. The dietary supplement manufacturers are responsible to make sure that they are safe before are marketed, but they do not require any approval from the Food and Drug Administration. These manufacturers may not claim to treat, prevent, or cure any specific disease. Are glucosamine and chondroitin good for arthritis? Where is this controversy coming from? Well, some people are saying that the dose that you take is important. Many studies use doses of glucosamine sulfate of 1500 milligrams per day and chondroitin of 800 milligrams per day. Other people are saying that the brand of the product matters, or the type of the product that you use. For example, this study suggested that a pharmaceutical grade of chondroitin might actually be better. Let's look further into this study to understand the findings better. They included 600 patients that received 800 milligrams of chondroitin every day. These researchers showed that pharmaceutical-grade chondroitin was actually superior to placebo, but similar to non-steroidal anti-inflammatory medication like colecoxib in reducing the pain and improving the function in patients with osteoarthritis of the knee. These patients used chondroitin for approximately 6 months. It is important to know that this study was supported actually by the company that produced the chondroitin. How long should patients use glucosamine or chondroitin? One study published in 2010 showed that patients that take these supplements for long term, 2 to 3 years, may actually have delayed progression in their osteoarthritis. There are also studies that do not support these findings, and I think it's important to know about this as well. Now think about the placebo effect, and I will remind you, what is the placebo effect? A placebo is anything that seems to be real, like real medical treatment, but it isn't. When you get placebo pills, they do not contain the active substance. In many studies, researchers compare the effect of a medication with placebo to actually understand if there is a real treatment effect or is just the mental belief of the patient that he gets improvement. Now let's come back to the glucosamine and chondroitin, and I will discuss a landmark study called GAIT, or Glucosamine Chondroitin Intervention Trial. They included about 1,500 patients with knee osteoarthritis. The researchers compared glucosamine, chondroitin, alone or in combination with placebo and anti-inflammatory medication. Overall, the glucosamine and chondroitin alone or in combination did not decrease the pain in patients with knee osteoarthritis. However, a subgroup of patients might actually get benefit from these supplements. Those were patients with moderate to severe osteoarthritis. Another study called MOVES trial found the combination of glucosamine and chondroitin as effective as colecoxib, which again is a very well-known anti-inflammatory medication. And that effect was to relieve the pain and swelling in knee osteoarthritis. What is that meaning? These supplements could actually be a good alternative for people that aren't candidates for anti-inflammatory medication because they might have other cardiovascular or gastrointestinal conditions, so they are not able to take an anti-inflammatory medication. Are these supplements recommended by the osteoarthritis guidelines? Currently, due to these conflicting results, the osteoarthritis guideline do not endorse the use of glucosamine and chondroitin for patients with arthritis, especially osteoarthritis. Considering the safety profile is good, you may try to use them for about 6 months to see if your pain is improving. Before you start any supplements, I do advise you to discuss your clinical condition with a physician that will be able to review your risk and benefits. Supplements can be dangerous in certain situations, and they can influence the way that other medications are absorbed. This is just an educational lecture that will not provide you with medical advice. If you like the educational content of these videos, do not forget to share, like, and subscribe to my channel. In the next lecture, I will discuss turmeric and its use for patients with rheumatoid arthritis. Have a great day, and I'll see you soon.
rheumatologist OnCall.com